Those right to go? Good morning, thanks for being with us. There are 71 new local cases of coronavirus in our state. 49 of those are linked to known outbreaks. 22 cases have their acquisition source under investigation by our public health team. At least 16 of those were in isolation for the entirety of their infectious period, but obviously 16 out of 71 is a significant concern to us. Jereon will speak more to that kind of epidemiological and outbreak map, and with particular focus on Shepparton and some other inner western suburbs that are a challenge for us. 29 people are in hospital, 9 of those are in intensive care, and 5 are on a ventilator. We obviously wish them well, and we send our best wishes to the dedicated teams of nurses and doctors and others that are treating them, and indeed all of our health team, from ambos who are transporting patients all the way through to cooks and cleaners, ward clerks. All of them are doing an amazing job, and so much of this strategy is about preventing a situation where they are given an impossible task, where they are given thousands and thousands of patients to treat when that is simply not possible. One of the most challenging things I'm sure that the New South Wales government and the community in New South Wales are facing at the moment, because we've been there, we were there last year, to have 400, 500, 600 patients admitted is really, really hard. And I think later this week we're going to have a couple of nurses who nursed right through that really challenging second wave in Melbourne, and they might, I think, remind us all in very powerful terms of just how challenging that is, even with 500 patients, let alone when we start adding zeros. Many thousands of patients will overwhelm all of us. So we not just send our best wishes and thanks to our staff here in Victoria who are doing an amazing job, but also to those staff in New South Wales who must be working under extremely difficult conditions and circumstances. That means there's a total of 494 active cases across Victoria. Very pleasingly, 46,446 test results came to us overnight, so the vast majority of those were done yesterday, as we're getting everybody's results to them, 99% of them the day after. So I'm very grateful for a Sunday, that's a very strong number, and I'm very grateful to all of those who came forward and got tested. Thank you so much. To the 22,191 Victorians who got vaccinated yesterday, thank you as well. That's a very powerful contribution and a very strong number again for a Sunday. In fact, we had our biggest week in state clinics last week, 186, just shy of 186,000 jabs last week. And again, thanks to not only those who came and honoured their appointments and came forward, but thanks also to all the staff who make that possible in a safe way. Now, to that end, I can report today, just as I did on Saturday, and this will take me a little while, but I think it's worth spending time on it. There's 52,566 vaccination appointments available over the next 7 days. Just to give you an example of where those appointments are available, because it'll hopefully trigger people to act and go onto the website and book an appointment. Right now, at the Ford factory in Geelong, there are more than 4,800 appointments over the next week. At Sandown Racecourse, 3,300. Wyndham Civic Centre, there's about 1,000 appointments available over the next week. In Melton, 4,700 appointments. At the Melbourne Convention and Exhibition Centre, there's some 4,000 appointments. At the Showgrounds, Melbourne Showgrounds, there's some 2,200 appointments available. Plenty Ranges Arts Centre in South Morang, there's some 2,300 appointments, and there's also 1,700 appointments approximately available at Frankston's Bayside Centre. It's not just about Melbourne though, and Geelong, it's right throughout our state. So to give you a couple of other examples for regional Victoria, Wonthaggi Town Hall, there's about 865 appointments available there over the coming week. The Wodonga Vaccination Hub, there's just under 800, and at Shepparton Showgrounds, there's some 300, just a little bit above 300 appointments available over the next week. So there are both Pfizer and AstraZeneca appointments available right across the state. Please go online, please book an appointment with confidence, please turn up, get that first dose, and for those who've had a first dose, please be vigilant around getting your second dose on time. Each and every one of those visits, each and every one of those appointments takes us a step closer in that race to 70 and then 80% of our community having been vaccinated. That means that we don't have to be locked down, certainly not statewide. We don't have to have many of the rules that are essential and our only option at this time. those vaccination numbers give us many other options, and they're all much better than the very limited set of options that every state and the national government have reluctantly and with a heavy heart had to sign up to. This strategy is a national cabinet strategy. If we had other options, we would of course use them. And I just want to take in recognition of the fact that this is a partnership between our government and the Commonwealth Government. I want to thank the Prime Minister and the Federal Treasurer for their equal part in now, I think, the fourth or maybe even the fifth set of business supports that were announced yesterday, with a strong focus on regional Victoria, given the regrettable decisions we had to make on Saturday. We are all in this together, and we have got to find it in ourselves, find a way to push these numbers down while we continue to get the community vaccinated as fast as supplies will allow us. I've already spoken to the fact that regardless of extra supply coming, we have a number of appointments that are not filled, more than 50,000. Hopefully, today and tomorrow, many people watching this and listening to this will, because they're already eligible, will be prompted to go and make an appointment. Then turn up and play your part in vaccinating our way out of this, vaccinating our way into a very different set of rules, all the while driving these numbers down as low as we can possibly get them. I will, however, this week, because we've got some additional supplies coming to us, hopefully we'll be able to firm that up. We'll be able to confirm that those promised shipments are in fact going to get to us. And we'll be able to talk about, hopefully, a strategy where we can do more than the 1 million vaccinations that we had committed to do as a target over 5 weeks. We're a bit more than a week in. We're pretty close to target. We think we may even be able to exceed that 1 million jabs with the support of so many Victorians, of course, and our workforce. But supply does remain a limiting factor in the broad, but there are still appointments that are available right now, and I'd urge people to make those appointments. And I would also, with the greatest of respect, because it is a very personal thing, I know, but if you've got an appointment, please don't not show up for that appointment or cancel that appointment because of announcements that have been made and supplies that may be here in a week or a month. There's no guarantee that you are doing anything other than perhaps joining a waiting list. If you've got an appointment, please come forward, go through that consent process. There's Pfizer and AstraZeneca appointments that are not full as I stand here right now. Please come forward. If you've got a booking, honour that booking and play your part in protecting yourself, your family, and indeed every family. Play your part in making sure that lockdowns are not something that we have to endure for a moment longer than they are the principal and only option available to us. 70 and 80% will mean we have many more choices, many more options, and they're all better than the very challenging circumstances that we face now. I might now ask Jereon, just one further thing before I ask Jereon to speak to that outbreak map, if you like. Can I give a shout out to the Golden Valley community? Shepparton community are just quite amazing. It's a strong and proud community. They look out for each other. They're coming out to get tested in strong numbers. They're getting vaccinated in strong numbers. They're working with contact tracers. They're doing everything that needs to be done. And indeed, businesses in Shepparton are reaching out and supporting their fellow Golden Valley residents. I understand there's a Thai restaurant there that's been providing free meals to people that are in ISO. I'm sure they're one of many. Can I just thank them very much? It's the best of Victoria on display, and they should be very proud of that, and we're certainly very proud of them. And we'll continue to support that community at a very difficult time. At the same time, though, not just in Shepparton but across the board, if you are asked to isolate because you are a primary close contact of someone who has been confirmed as having had this virus, so you've been in the company of someone who's positive, or you've been to an exposure site, if you're asked to isolate, it is incredibly important that you do that. There's no ducking down the shops or going and visiting someone, or there's no room for error. There is literally no room for error. You've got to be isolating for the entirety of that 14-day period. And I'll just reference the number of day 13 tests who were positive at the end of the Al-Taqwa outbreak, despite the fact that literally 100% of them had been tested early on. They turned positive over that isolation period. Just shows us that you may feel well, you may feel that you've not been infected, only then to subsequently test positive within the 14 days. It's why we have a day 13 test, and it's why you have to be formally cleared before that isolation period ends. So just a reminder to if you're asked to isolate, it's because you have to. It's absolutely imperative that you do that. It's critically important. There's no option. You've got to do that. And if you need support, then we stand ready to provide that to you, both financial, but also many other practical ways in which we can support you. There are lots of visits and trips to chemists to fill scripts. There's lots of stuff that's being done to support literally thousands of people who are doing the right thing. But everyone has to do the right thing when it comes to isolating at home when asked to do so. Otherwise, you'll just spread the virus and mean that many more people have to isolate their contacts and the contacts of contacts. It is zero room for error. So I just remind people about that. I'll now ask Jereon to take us through that outbreak map, and then we're happy to take any and all questions you have.
Thank you, Premier, and good morning. So 71 new cases today, and that means 494 Victorians now have coronavirus in this current active outbreak. There are 29 people who are currently in hospital. 9 of those are in ICU, and 5 of them are in ventilators. And those numbers have shifted significantly in the last 3 or 4 days. And we wish, of course, all of our very best wishes to people who are recovering from coronavirus at this point in time. We have 14,000 people as primary close contacts. Those numbers again have risen, in particular with regard to the Shepparton outbreak, and 9,000 secondary close contacts at this time. I'll expect those numbers to continue to evolve over the coming days. There are now 613 exposure sites across the state. I'll work through the numbers of the 71 cases in a bit more detail. 14 of those are associated with our Shepparton outbreak, and that means there are now a total of 36 cases in that Shepparton outbreak. We have 10 of today's cases associated with the Newport cluster, which now takes us to 61 active cases in that Newport cluster. We have 8 of today's cases associated with the My Centre childcare facility in Broadmeadows, taking that up to a cluster now of 50 active cases. And we have 5 cases in today's numbers associated with the Royal Melbourne Hospital, which now takes us to 10, the positive cases associated with the RMH. We also have 12 cases in today's numbers who are household contacts of previous cases that we understand well and know their mapping. But we also have 22 mystery cases today. That compares to 11 mystery cases we had yesterday and 10 the day before. That's a significant jump. And we're seeing again a spread into new suburbs in the Melbourne area, suburbs like Essendon West, Camberwell, Thornbury and Fitzroy North, Maidstone, and then all the way down to Sorrento. It highlights again the points we've been making over the last few days, that we're now seeing an increasing number of suburbs and LGAs where we have active coronavirus cases. Of course, a lot of work for us to do on those mystery cases over the coming hours and days to understand those other linkages. Where we find one case, we are very likely to find more. And that shows a growing pattern of coronavirus cases, and so important, therefore, that not only do people comply with their isolation protocols, but for all of us, wherever we're living in the state, we need to be really aware that COVID can just be around the corner. We can still grab this and get hold of this and manage these numbers down, but that's going to require all of us to work together. In terms of the age profile of all of our cases, of the 494 Victorians, 112 are children under the age of 10. 100 are people aged between the ages of 10 and 19, and a further 79 are in their 20s. Again, it's a very, very young age profile of people currently active with coronavirus in the state. And what we've seen in this outbreak, going right back to the beginning, 2.5 weeks ago, we have seen kids get COVID. We have seen kids spreading within their families with a very high attack rate within their families, as the Premier just outlined with the example of some of the schools. We've also seen kids transmitting to each other. So nobody in this state is safe or immune from this, and I'll give some other examples as I go on. With regard to the Shepparton outbreak, we now have 3,753 identified primary close contacts, a third of whom have returned a negative test result so far. I can add my thanks to the fantastic work of the Shepparton community over the last few days, particularly Goulburn Valley Health and their teams. We tested 5,500 people on Saturday and Sunday at some very busy testing stations. We have even more testing resources being set up today in Shepparton. We'll continue to test as we work through this over the coming days. We have 3 schools now involved, Greater Shepparton Secondary College, in particular the Maguire campus, and around it's a large school, multiple campuses, over 2,500 people are now primary close contacts associated with the school. We also have a positive case associated with the Notre Dame Secondary School and St Mel's Primary School. And of the 36 active cases currently in Shepperton, we now have 8 households who are impacted in some way, shape or form. And again, I expect to see those numbers increase over the coming days. The cluster at the childcare centre in Broadmeadows is now up to 50. We have 1,200 primary close contacts, and of the primary close contacts associated with the childcare centre itself, 82% have returned a negative test result. That feels like it's starting to stabilise, and my thanks to everybody around Broadmeadows, particularly the operator of the childcare centre, for their very swift and prompt action, and of course that wider community of parents and teachers. Your support and active isolation will be very important over the coming days. We have no new cases today in the wider St Kilda clusters, so the work of the end of last week. I remain concerned about the number of loose ends we have around the St Kilda area. We still have our additional testing facilities up for a few more days in St Kilda, and again I'd urge the wider St Kilda community to come forward and get tested if they have any symptoms whatsoever or any concern around those exposure sites. Just because it doesn't lead the news doesn't mean it isn't dangerous for you in your locality. And then the continued concerns around Newport, 352 primary close contacts, 3/4 of those have returned a negative test result. I'm particularly appealing to really to younger men in the Newport area, Newport and Altona North area. If you're active in the community, if you're in your 20s and your 30s, if you're connected to the footy club, if you're connected to the gyms, if you're active in the community, please come forward and get tested. We really are concerned about this ongoing emergence of cases in the Newport area. We had some very good meetings last night with community leaders in the Altona North and Newport area, but please, we need to double down and really get to the bottom of what's going on within the Newport area. I thought I might just focus briefly on those who are ill and also our health services. So of the 29 people currently in hospital with COVID, 21 are under the age of 50, and there is 1 infant amongst those people. Within ICU, we have 1 person in their 20s, 1 in their 30s, 5 in their 40s, and 2 in their 50s. Again, a very young age profile for an ICU unit. Nobody who is in ICU has been vaccinated at this point in time. And then finally, in terms of our health services, we've seen a significant, over the last week or so, significant impact on our health services. And this is one of the challenges with more widespread COVID community transmission that we're now starting to see. And this is a scenario that we really need to pull up very quickly. We have a number of hospital, particularly emergency departments, who have now been impacted with COVID positive patients coming in off the street, including Mansfield and Wangaratta emergency departments, Mercy Werribee, we talked about that a few days ago, Footscray last week, the Alfred also last week, Sunshine Hospital yesterday, and of course the Royal Melbourne. And the Royal Melbourne case again shows you how rapidly COVID can move through our community. We had a patient who was taken into the Royal Melbourne, transferred from Shepperton on the 12th of August in for planned surgery. That planned surgery took place. She was in hospital for the entire duration, and it is believed to be the index patient for a coronavirus cluster that now includes 10 people, some nursing staff and 1 or 2 other patients, but also now has an impact of 450 staff being furloughed at the RMH. That is a significant impact on one of our most important and prestigious hospitals. The RMH team are doing a fantastic job in working around it. My thanks to them and the wider health services across Melbourne for their response to this. But it shows you how a relatively small number of cases can have a huge impact on our health services and the measures we'll have to take to measure that, to deal with that. In terms of dealing with that, from now on, there will be testing before all planned operations will require COVID testing beforehand. Those arrangements are being put in place now by all of our health services. Some have had that in place for a while. And all of our emergency department staff are now in Tier 3 PPE. The implications of that are that for every single emergency room staff member, they're now spending their entire shift in an N95 mask, in a full visor, and in protective gowns and gloves for their entire shift. That is a significant, it's an unpleasant, it's hot, it's hard work, and this is the implication of seeing these rumbling cases running through parts of our community. I would like to a huge thanks now to all of our healthcare workers. We now all have to step up again to deal with the growing number of cases we're seeing in the community and be prepared for these cases coming through. There's a lot of work happening in our health services, and my thanks to them, their leadership and their frontline staff for all their work they're doing to make sure we get through the coming days and weeks as well as we possibly can. Finally, in terms of vaccinations, as the Premier said, a record week last week, 185,970 vaccinations delivered through our 50-odd state clinics, and my thanks to all those vaccination teams for the work they're doing. 85% of those aged over 70 have now received at least their first dose of the vaccine. 78% of over 60s, or Victorians in their 60s, have received the first dose of the vaccine. For those in their 50s, 72% have had at least a first dose. And for those in their 40s, 64% have had their first dose. And can I add my encouragement to those of the Premier? If you've got a vaccine appointment this week, please use it. The Commonwealth has made it clear that there'll be wider availability in the weeks ahead for Pfizer. That'll just mean a longer queue for what is still a limited supply of vaccine to the state. We need people to get vaccinated now. We can see that we're seeing a growing number of cases every day. We're seeing mystery cases. We are doing all we can across the community to keep those cases under control, but there is no time now to waste in order of getting people vaccinated. My final message is, please, for everybody, please stay home. Do not go out. Do not mix in this environment where we have cases that are out there in your suburb. If you have any symptoms whatsoever or any concerns, get tested. And if you can, please get vaccinated. I'll hand back to the Premier for questions.
Thanks very much, Jereon. I'm happy to take any questions you have.
Premier, just for the avoidance of doubt, are you able to?
Why don't we go Paul and then we'll go Simon.
Apologies, sorry, Simon. You talked about potentially needing to go harder if the situation worsened on Saturday when you announced the regional lockdown. Are you considering any more restrictions? Are you comfortable with the current settings?
There's not too many more restrictions that we can put on, Paul. Ultimately, the thing that will make the difference in bringing these numbers down further is compliance with these current rules. And I know it's incredibly difficult. It is incredibly difficult. But now, and look, I've never been, and I won't be start now, being critical about people who've got different views. Everyone's entitled to their opinion. Everyone's entitled to their views. But I see a lot of people out there that are very upset with these rules, like we all are. No one's happy to have these rules on. But I just pose a question back to all those people who are frustrated, perfectly reasonably. You know, there's every reason to be frustrated. This is a global pandemic. None of us want to be in this position. But I think it is fair and reasonable to pose the question back, okay, well, if you're not happy with what's happening now, none of us are, by the way, what's the alternative? Righto, let's get everybody vaccinated. Well, I don't have supply. I don't have enough vaccine to vaccinate everyone, or even to get to 70%, 80% next week. It's going to take time. Now, I might be upset about that, but it doesn't mean more vaccine turns up because I'm angry that more wasn't ordered last year or whatever it might be. That doesn't change it. The other option, I suppose, would be, well, we'll just open it up. We get all our freedom back and we just, we desperately want it to be over, so we pretend that it is. Well, we know what that means. We know what that means. It means thousands of people finish up in hospital. And from all age groups. From all age groups. So there's a reason why the Commonwealth Government helped pay for half the business support yesterday. There's a reason why New South Wales is locked down, Queensland has been locked down, South Australia has been locked down, every part of the country has been locked down when they've had cases, because that's the agreed position, because that's the only option. I understand people are frustrated, I get that, we all are. But if there was another option, then we would have chosen that. Every single leader in the country, from all political persuasions, from all points of view, we would have chosen something different. So, it's a bit like the protest on the weekend, terrible scenes, ugly scenes. And today's Monday and the virus is still here, because protests, however agitated, however appalling, however willing, don't work on this. So compliance with the current rules is what has driven these numbers down in the past, and it's what will drive these numbers down in the future.
Can I ask about options? We've had 30 mystery cases in 3 days now.
Yep.
That's an out of control outbreak. We have a week left, or about a week, until this lockdown is meant to end. Tony Blakely, you would have seen Tony's comments today.
Yes.
He's questioning whether we can get anywhere near, 0 cases in the week and a half we have until September 2.
Yep.
Are we in one final dash to try and get down to 0 with these really tough restrictions? But then at that point, if we can't do that, would you consider going to a lockdown light to ease the mental health burden, to ease the economic burden, to get us and then race to 70, 80 in that kind of more
Yeah, I understand.
Lockdown with a lower burden level.
I understand what you're putting to me. Let me just firstly, I can't predict what settings will be recommended to us by the Chief Health Officer in a week's time. I simply can't. And I've said to you, as I've said a few times, I don't have a crystal ball, and I wish I did, but I just don't. On the and I don't want to have a dispute with you, Paul, but I think what Tony's saying is that there are a number of options. He's at pains, I think, in his article to not necessarily say that he's advocating any of them. He just wants us to talk about them, right? So that is slightly different. But on that, there's a few sort of things that have to be taken for granted in that we've got adequate supply to get to 70 and to get to 80 on the agreed timelines. That's not necessarily a given. The notion that, well, you could probably hold cases to a lowish number while you did that. So it bubbles over here while we vaccinate our way out of it. What Delta's shown us, sadly, and this is the greatest challenge we face in many respects, is that the notion of Delta bubbling is really hard unless you've got really tough rules on. So you start to open up and it won't be bubbling, it'll be raging. So then it's that very fine balance between, okay, yes, there's a mental health impact, of course there is. We understand that. But the notion that we could vaccinate people, I'll put it this way, the notion that we could vaccinate people as fast as the Delta virus infects people, that is not what the Doherty modelling shows. It is not the National Cabinet agreed position. We could open up tomorrow and say, righto, we're just going to vaccinate, day and night. We don't have the supply, and Delta will move faster than we can vaccinate people. That's if you're trying to distill all that down into one thing, it's a long way of saying, we'll look at all options, of course we will. And the Chief Health Officer stood here so many times and attempted to explain to the people of Victoria that he never makes these decisions, he never provides this advice lightly. He's always weighing up a whole lot of different factors. Physical health, mental health, not just COVID. Issues about, a health system that's swamped will be a health system that is unavailable for everybody, not just COVID patients. Anyone who has an accident, anyone who has a stroke, anyone who needs that urgent care, it'll be really challenging. And he also, the economic stuff is part of the considerations we probably bring to bear more than him. But it's as balanced a position as possible. And I know if he had 7 other levers to pull, or even just one, like an easy option, he would choose that, and he would advise us to do that. And be in no doubt we would.
Just on childcare, just for the avoidance of doubt, can you outline the rules around eligibility and there's been
I think there had been
confusion in the
some.
past
Yeah, look,
24
I
hours.
want to apologise for any confusion that was there, any lack of clarity. The Chief Health Officer has signed, Professor Sutton has signed orders that come into effect tonight. That mean one parent in a household who is an authorised worker will mean you are eligible for a childcare permit. And I apologise if there was any sense of any lack of clarity around that in the lead up to what I've just said. But they are the orders that have been signed, and that is the position.
And it comes
And
into
beyond that, if people want to check their eligibility and whether they are or aren't authorised, the website has all that details. But it's not both parents in a household. It's one.
and it comes into it comes into effect tomorrow, correct?
Yeah, I think it's 11:59 tonight.
And
is when it comes into effect.
would you be advocating for the federal government to provide some of the gap fee assistance that they provided at this time last year, given that it would be a huge strain on childcare centres?
Yeah, it's certainly on my list to have some conversations, and myself and colleagues will be speaking with the federal government around, well, what does this mean for the childcare sector, because we need them to be there on the other side of this, and what does it also mean for parents who might be out of pocket and all those sorts of issues. It's quite a complex system, childcare, but I know there is certainly, if you have less kids going to childcare, then that's less income for childcare centres, and that can be a pretty finely balanced industry. And the point is that last year we did have a package that kind of provided a safety net to that whole sector. The virus and circumstances this year dictate that we have to go back to these settings, but I don't know that support is there. So we have and we will continue to speak with the Commonwealth about that.
You've alluded to the fact that close contacts who should be isolating for 14 days haven't been. Do we have any idea on how many people aren't? Are we talking a couple or dozens?
Yeah, it's not. I don't think it's a significant number, but it only takes one, Bridget. That's the whole thing. So it's not a matter of, it's not like we've got completely outrageous behaviour that if we did, we probably would call out. It's just that we just have to remind everyone with that sense of purpose. You're asked to isolate for 14 days for very, very good reason, and you don't get to choose oh, well, 13 and a half days, or I'll just duck down the shops. There's no room for error, as many have been saying lately. It will spread. So you've got to isolate. And if you do, you're playing a massive part in protecting your family. A bit like getting tested quickly too. Like we have seen a few people they've just taken a few extra days to get tested. And this thing moves so fast that even a few extra days almost guarantees that you will give it to multiple other people. Your family, the people you love the most, and you don't want that. So even in a lockdown, you've got to get tested as soon as you register symptoms. If you are positive, we will support you in every way we can, financially and in all other ways. But part of that bargain is that you've got to stay at home for those 14 days so that you're not making anyone else sick.
How many extra cases of these breaches caused? Are we talking a handful, or are we talking?
It's very difficult.
Most of our cases.
Oh no, I wouldn't say that. It's very difficult, and I think that very difficult for us to be precise about that. I wouldn't want anyone to think that the majority of these cases are because of that factor or non-compliance issues. But even one extra case because of this, when it's so preventable, means that the team said to me today, can you please shout out? You give a shout out to the notion of people doing their 14 days at home. The Altaqua families did a fantastic job. They all got tested. So many of them were negative. When we went back on day 13, many of them had turned positive. So that's why it's 14 days, because 14 days is the relevant period. And I know it's not easy. Well, it's not easy to be only allowed out a couple of hours a day, let alone not to be allowed out at all. It's very challenging, and we have thousands of people in that circumstance. We don't want any more, and that's why all of those have to do the right thing. And I just make the point: if you get tested today because you've had a sniffle or a scratchy throat or any symptoms whatsoever, and you're not going to get a shift tomorrow because you're going to be isolating waiting for your result, we will give you $450. If you are positive and you have to isolate for the 2 weeks, we'll give you $1,500. So if it's wages you're going to miss out on, and that's what's motivating not getting tested, for instance, we've got that covered. Beyond that, if there's other things you need, then there are literally hundreds and hundreds of people who are out there providing support of all kinds to all those thousands of people that are doing the right thing by the rest of us.
Are there any
Any
cases?
insight as to why mystery cases have doubled over the past 24 hours?
No, that's the nature of mysteries. When you finish up with significant virus in the community, it's very difficult. And also, can I say, I think the second of the two factors I just spoke about, like not getting tested as quickly as possible, that'll always increase the chances of cases out there, because the virus is circulating and it's not always clear where the person got it from. Even in lockdown circumstances, we have cases of people who are not known to each other. They were not even aware they were in the same space as each other. But this thing is highly, highly infectious, and it's rapid in the way that it moves.
Are we seeing a change in behaviour?
And look, and the other thing too, I would just say, their mysteries today, coronavirus detective work that's going on right now and will go on, tonight, tomorrow, and for as long as it needs to, that may well find some links. Now, it may not. Sometimes you don't find the ultimate link. You can't find every single link in the chain, right back to the top of the chain, if you like, the index case. But we have seen, I think Jereon would support this, that the map, sort of the puzzle fills out a bit. So you'll find links, not back to the ultimate source, but you can find links further up. But look, we are focused on stopping the spread further. That's the real key. That's what the lockdown is for. That's what prompting people to test is for. That's what the work that Victoria Police are doing, visiting literally thousands of people every day. I don't want it to come to the point where we're visiting someone and they're not home. We've seen very, very high compliance, and I thank people for that. But it's just a reminder, it's 14 days for a reason.
Are there any cases today or under investigation linked to the demonstration on Saturday?
I don't believe so, no.
Premier, I'm tested.
But I would urge anybody who was at that demonstration or anywhere, if you've got symptoms, regardless of what you do for a living, your views on any subject whatsoever, if you've got symptoms, you need to go and get tested, because there's not a lot of cold and flu around. That's what the doctors tell us.
While we're on that point,
Sure.
there is a police officer now in hospital awaiting surgery because of what's happened.
It's shameful.
I
spoke to the Chief Commissioner on Saturday and asked him to pass on, at that stage it was 6 officers who'd been injured, to pass on my best wishes and the best wishes of all law-abiding Victorians to those officers and their families. Victoria Police members of every division, every part of Victoria Police have had a very tough 12 months, Think about some of the tragedy that has had to be, borne by that police family and police families. None of us should be making the job of police any harder than it already is, and none of us should ever act in that way towards members of Victoria Police. They're there to keep us safe. They put themselves in harm's way every day. Some of the scenes on Saturday were not only disgusting, but they were absolutely unlawful, and the full force of the law will be upon those people. That's what the Chief, it's not me saying, it's what the Chief Commissioner has said, and I fully support him in that.
Just on the testing delays, do we know how long it was between when that man from Shepparton was admitted to the Royal Melbourne Hospital and when he was then tested positive for coronavirus?
No, I don't, but we can try and follow it up, notwithstanding, obviously, privacy issues.
Just on the
But
Shepparton,
we're getting enormous amounts of testing done, and done really fast.
Just on
Really
the-
fast, and I thank our laboratory staff for, it's quite amazing, like 99 point something % of people are getting their results the following day, and that is incredibly important in trying to keep pace with this thing. There are, I think that it's not no sense of criticism, but I think over the course of the weekend, I think health officials in New South Wales have made the point themselves a number of times that yes, they're doing a lot of tests, but it's really challenging to try and keep up, and because the thing moves so fast.
Sorry, the question's not about how long did it take for the results to come back. How long after he was admitted for surgery was he then tested?
I don't have that, but I'm happy to try and chase it up for you.
Thank you.
can I just ask a question on that Shepparton case? Minister Foley yesterday said that our healthcare system was already at capacity prior to these outbreaks. So we've seen a couple of prominent outbreaks in prominent hospitals. So
Yep.
with hundreds of medical staff in isolation, how do we expect for our healthcare system to keep treating patients moving forward?
Well, I've been a health minister, and if you ask a health minister on any given day, is the system at capacity, the answer will always be yes, because we paint right out to the edges. We work as hard as we can to treat as many patients as we can. We have additional capacity though, and we can reprioritise patients. Like elective surgery is still happening. There'll be some disruptions in some health services, but there's no blanket decision around elective, because we want to try and get those patients through, because many of them should have had their surgery last year, but the pandemic disrupted them then, and we want to try and get them through safely now. There are ways in which we can further prioritise the sickest patients, but I suppose the best way to answer your question, and for anyone who's interested, is our public hospital system operates on one fundamental principle, and that is the sickest patients get treated quickest, and that's the only way that it can be. So if we have more and more really acute patients, then we will reprioritise, we will move resources and add to resources. But you're right, furloughing is tough. That's why we've got to keep this out of hospitals as best we possibly can. And the best way to do that is to have less virus in the community, because then that means there's less chance of it getting into our hospitals. If you look at, and I will have some nurses come and speak to you later in the week just to tell you some stories from last year. I think it's worth reminding everybody. They'll never forget it, and I'll never forget being told what it was like. But I just, again, what those nurses and doctors and others will be going through in Sydney right now, we don't want that here. And we've got to do everything we can to prevent it.
I asked you a couple of days ago about striking the balance of isolating staff and also
Yep.
accommodating to those that require. So anyone with a pre-existing surgery or medical procedure, do you foresee this will be impacted?
Well, at this stage, as I said, elective surgery has not been cancelled. It's still on. We're still doing it as fast as we possibly can. There will be, in some hospital services, there'll be knock-ons, if you like, but it's not system-wide. And I think we would never want a situation where, say, use an example, Werribee Mercy had some issues the other day. I would never want to take away from the CEO of that hospital their ability to respond to that and to maybe move some bookings and make some changes, just the same at the Royal Melbourne. But there's no system-wide change. It's still happening. But I'm just trying to be upfront by saying there'll be some impact in some hospitals because they're dealing with challenges.
Okay, so why weren't patients tested prior to, just to finish up on this, why weren't patients tested prior to surgery?
Well, we have tested patients prior to surgery at all manner of different points during this pandemic. My advice today is that we are doing that again now, right across the board. Some have done that all the way through. But I would just say there are some people for whom that's not possible. If you're an urgent surgery case, then we can't test you and wait for the result. We will assume that you don't have it and get you the care that you need. There's some rapid testing being used. There's all sorts of different testing technology and approaches, and all the health team are there to keep people safe and do their very best. But as this Delta and as this outbreak shows us, if we have to go further, then of course we will.
Last year there was a maximum of about 45 patients in ICU in Victoria at any one point, and that's when we had no aged care residents vaccinated, no vulnerable people vaccinated.
Yes.
We had about 500 ICU beds last year. We now have
Roughly,
about
yeah.
1,600 beds ready to be used as an ICU bed in Victoria
Yep.
at the moment. So it's been
Yep.
tripled. We have more than any other state at the moment because there was a massive investment last year.
There was, yeah.
There would need to be tens of thousands of COVID cases in Victoria to fill up the number of ICU beds we have. Is the bigger issue that once a single staff member gets infected or becomes a close contact, so many staff get knocked out of the system? Is furloughing and staffing the issue rather than the actual number of sick people who'd fill up ICU beds? Are you conflating those two issues?
No, not at all. The sad fact of the matter is that both those things are challenges, and you don't get to choose either or. Like, I'm sure if you sat down in meetings that were held up in New South Wales 6-8 weeks ago, they didn't think they'd have 10,000 active cases. In fact, I think they've got more than that now. You know, that's how fast it moves, and that's with lockdowns on. That's with all manner of rules. So,
they have
no, you're saying that
20% of their ICU capacity at the moment is COVID patients.
Yes.
It's 3/4 full ICU in total, but
Yep.
only about 20% of those ICU patients have COVID,
yeah,
and they're at 800 cases a day.
yes.
So-
But I'm struggling. But what's your point, Paul?
My point is that COVID.
Sorry, I apologise if I'm not following.
No,
but what's your point?
my point is that COVID patients are not even close to stretching their ICU capacity at the moment.
Yeah.
It's getting close to about 90% ICU, but not many of those are COVID patients.
Yes. A couple of points. One, you don't have to be in ICU to be very gravely ill, right? Not everyone who is gravely ill is in intensive care. There are high dependency unit beds. There's a whole scale, right? Talk to any nurse. Nursing patients, whether they're in intensive care or otherwise, with COVID is very, very challenging. I'm not quite sure what the question leads to. Like, they've got a lockdown on at the moment. That's the only reason that they haven't got higher percentages of their ICU being used and higher percentages of their ICU being used by COVID patients, effectively bumping everyone else. The only reason that's not the case is because they've got lockdown measures in place. So I understand there's a lot of debate and discussion about, well, can't we find another way? This isn't sustainable. This is difficult, challenging. All true. This is the only way, and that's why every government in the country is doing it, and it's why we're not making other choices, because there are no other choices. And I suppose my challenge to people can have views, that's absolutely fine, but we're not commentators. We've got to have views, yeah, and then we have to make a decision. And the decision on the best advice that every government in the country either has made or is in the process of making living now is that if you let it run, it will overrun your ICU and it will overrun your hospitals. And that's when New South Wales isn't there yet. That's a good thing, though, isn't it? We're not there yet. But this notion that it's all linear and you can we could let like a tap, or we could let it off a bit, let the restrictions off, cases would grow, vaccination could stay in front of that, and then we could all kind of be much more free and find that magical point where peak vax is before we get to peak caseload. Delta makes that incredibly difficult. And if I might say, there's some parts of the world that have been held up as the exemplars who are currently, right now, thinking about going back into lockdowns that don't let people go more than 100 metres from their front door. That's how finely balanced it is. Nothing about this is linear, sadly. Yes. Sorry.
When we get to 80% vaccinations, Premier, does that still mean that we will guarantee getting out of lockdowns? Is that still your view?
The national plan is very clear. At 70%, less likely. 80%, and I know it's only 10 points above the 70, but it is meaningful. It's really meaningful. That's what the Doherty modelling tells us. I think it is highly, highly unlikely that we'd have anything like a statewide lockdown as I stand here right now. And there wouldn't be one unless it was advised, but that's the current advice. You could, however, let me just use the example. I know, again, I'm not being critical in any way, but it is a contemporary example and one that I think works to try and understand what the difference between 70 and 80 is. In Western New South Wales, they've got some challenges with a couple of Indigenous communities, remote communities. We wish them well in that. And my good friend Mark McGowan has sent a whole lot of resources there, and we talked about this at National Cabinet on Friday. It's a real national effort to try and support them. You might, for instance, for those sorts of reasons, if a community was under-vaccinated or at higher risk, you might have a localised set of rules. But the notion of a statewide set of rules around lockdown, getting to 80% means that we can avoid that. We might still have to wear masks, we might still have rules about gatherings and some of those things for a period of time, because, you know, if you think about it, say pick 75%, right? So if 75% of the nation has had 2 jabs, that means the equivalent of the population of Victoria has not, which is the same as the population of Singapore, Ireland and Israel. That's a lot of people, right? That's why we've got to get everybody vaccinated who we possibly can. And 80 is a very strong number, and there's a lot of parts of the world that wish they were at 80 and they're not. We've got to get to that, and if we can do more, then we have to do more, because the less people that are left unvaccinated, the smaller and more manageable the pandemic of the unvaccinated will be. Because that's what's happened in America, it's what's happening everywhere. So we'll get infections, we'll get hospitalisations, we'll get to that world, Paul, where it's much more about numbers in hospital, not numbers of cases reported every day. But you can't do that until you've got the safety net of a very high vaccination number. And we don't have that yet.
In terms of 70 and 80%.
Sorry, did you have a follow-up? And then
Just on vaccinations, New South Wales on Friday did about 120,000 vaccinations, and Victoria did about 69,000.
Yep.
Do they have more supply? Why is that?
Well,
why
I think there's a couple of points to acknowledge here. When you have a really big outbreak, that is a call to action, and it does prompt behaviour. We saw that in a smaller form when we had some challenges a little while ago, and indeed there's a reason why we've had our busiest week last week, because these lockdowns and just the position we're in absolutely promotes people going and making the time to make a booking. I'll have more to say later this week about upping our capacity even further. We are more than half the total amount, so we're doing more than half the vaccinations in the whole state. I thank our pharmacists, I thank our GPs, and all of our staff in our clinics, but we're all going to have to do more. At this stage, though, the limiting factor is how much supply we have, but that hopefully and thankfully, that's planned to boost over coming weeks. We get into September and some of General Fruin's horizons, as is the term that's used. There's a whole lot of Moderna that's supposed to arrive, more Pfizer, over the course of September, October and November, and we'll be pushing as hard as we can, I'm sure everyone will be, to try and get as many jabs in as many arms as possible.
Just on the 70 and 80%.
You've said twice this morning now that once we get to 80%, the chance
Yes.
of a statewide lockdown is highly unlikely.
That's what the plan says.
But does that mean that localised lockdowns are still a possibility once we hit 80%?
Well, if the public health team were to advise that a measure like that was necessary, well then we would deal with that. But again, at 80%, I think lockdowns more broadly are not a tool that we would use unless we were advised to. And I think it's far less likely. Again, it's back to this crystal ball thing. I'd love to be able to give everyone absolute certainty on this, but I can't. Like, for instance, if you look at the national plan and the wording that's used, at 70%, lockdowns are less likely but possible, I think is the exact words that are used. Maybe I've got the order wrong, but that's the point that's made. At 80%, well, the chances of getting advice to lockdown, again, is less. Could I rule it out? Well, you know, I'd love to be able to rule out lots of things. But if because I could get advice, and what people know about me is if I get the advice from the doctors to do it, I'll do it. I won't second guess them, and I won't turn this into a political game. It is a public health matter, and if I haven't got that advice, I don't think I would get that advice. But I can't sit here and we're not making stone tablets here, mate. I can't rule out masks or some other measure if we had a really nasty outbreak in a vulnerable community, in a suburb or in a part of the state, for instance, in an aged care facility. We might lock down a whole lot of aged care facilities if we had a problem in aged care or a disability centre or whatever it might be, or a school in October. And I can't rule that out. And it would be wrong if I did, because then you'll be here, rightfully, you'll be here in, maybe in a few months saying, well, you said it wouldn't happen and now it is. We're all on the same side. We all hope it doesn't, though. And the best way to make it as less likely as possible is to get everybody vaccinated, and that's what we're working towards.
At 70 or 80%, to what extent will you pay attention to who remains unvaccinated?
Absolutely.
For
No.
example, if, there are a lot of 20-somethings who are unvaccinated, but nearly everyone who's over 50 is vaccinated, and nearly everyone who's vulnerable is vaccinated, how much bearing does that have
sure.
on your decisions?
Couple of points, and I don't think we're too far apart, but I have to be careful the way I answer this because I don't want to give an impression that to be 20 and have this virus means you're not vulnerable. You're not making that point, but I just want to be clear. We've got, as Jereon just said, we've got people of all age groups that are infected, and we've got people of all age groups that are in hospital. And to be in hospital with this, you don't have to be in ICU to be very, very unwell. So I think broadly the point you make is absolutely right, and yes, we would look at who makes up the 20%, or hopefully it's 15 or whatever the number is. Absolutely we would. And then that would guide some of the public health advice that's given to us and the decisions we make. The reason to get vaccinated is so that we're not locked down. I've made this point and I've been criticised for it, but I try to be as plain as possible. I don't want to lock the state down, lock everyone down, to protect people who wouldn't protect themselves. I probably can't be any clearer than that, Santo. Like, seriously, that's what we're aiming to do. I do have to add, though, there are a percentage of Victorians who can't get vaccinated, and we always have to think of them for many different reasons. But I think the story is you're painting a broader picture. We'd be guided by who's in the 80%, who's in the 20%, where's the outbreak, what's the position of the health system. All of those things would become relevant, and they become genuine choices, and they become possible of being calibrated when you're at 70 and 80. When you're at where we are now, the advice to me is you will not with the supply of vaccine we have, you will not vaccinate as fast as Delta infects. And that means we have to be locked down. I can't find a simpler way of explaining it than that.
Why haven't we mandated the jab for healthcare workers?
Sorry?
Why haven't we mandated the jab for healthcare workers yet?
Well, we have mandated it for some that work in the healthcare system. So, for instance, it's mandatory in residential aged care. And I can give you an update there if you like. I know that General Frewen has produced some maps or a list, I think, today of private aged care facilities, I think. We're at about 81, 82%. No one who's not jabbed is being rostered on in public aged care. That's the advice I have as recently as Friday from the Chief of the Health Department. We know there's still more to do in our aged care system. We have about 5,000 beds, more than any other state. So we'll keep plugging away and try to get that as close to 100 as possible. Private sector aged care is not quite at that 80%. They're a fair bit lower than that. But we've got lanes open in all of our 50 clinics, state hubs, to give people priority, and we hope that they come forward because we'll get them vaccinated as fast as possible. Beyond that, we are absolutely encouraging every health professional, whether they work in the public system, the private system, in tertiary care or in primary care, to get vaccinated. If that was the only challenge, we'd be very close to being done at the 80% mark. It isn't. We've got to get 80% of the entire community done.
Do we have a holistic picture for those that might not distinguish the difference between private and public?
Well, we'll have more to say quite soon about reporting of those who've been vaccinated and those who haven't, and I look forward to being able to make those announcements quite soon. And that we won't be leaving it to people's goodwill or good judgment to report. Like, we'll be getting those reports, and then we'll be able to act on them if we think that's appropriate. But many would have probably never thought of a day when we would, as a National Cabinet, agree that all of our aged care workers had to be vaccinated, but we made that decision. And I can't rule out, to your question, I can't rule out, if we saw really low take-up, we may have to make that decision in other areas. But that's not a decision you ever make lightly.
What about frontline workers more broadly?
When they first became available, is there a reason why you wouldn't mandate it for the whole healthcare sector?
Well, because we've got the vast majority of the whole health sector is, the only thing limiting them from getting vaccinated is how much vaccine we have. Like, they've been, our nurses, our doctors, everybody across the board, as they've raced to get vaccinated. We're now down to that kind of last bit, and we have to push. All of us have to. We're not to the point where I think there'd be advice and agreement across the country to move to be mandating beyond the mandates we've already done, and those weren't decisions that were made easily either.
Do we know how many young people have cancelled their AstraZeneca appointments or not shown up since the Prime Minister announced last week that under 40s could get 5 months?
I don't have age groups, but I can tell you that, on any given day, My latest advice, and I'm trying to get a breakdown of this as best we can without impinging on privacy, but we've got about 10,000 people a day that are either no-shows or are cancelling. That's double what it was a week ago. I can't change that. But I just say to people, it's why I'm making the point, if you've got a vaccine appointment, please honour that appointment, come forward. As the Chief Health Officer says, the best vaccine's the one that's available today. And getting vaccinated today is better than joining the queue in a fortnight, particularly if you're in that queue with hundreds and hundreds and hundreds of thousands of others. And this is moving pretty fast. And again, this is not a criticism, but it's just to show you that the total pool is getting bigger. Like, we had a really good conversation at National Cabinet on Friday about vaccinating right down to 12. So they're going to join the queue at some point soon. So if you can get it done now, now's the time to do it.
Because of the gap between doses, a lot of under 40s will be facing the dilemma between, you know, if they got Pfizer in 2 weeks, they'd be double dosed in all probability before they would be if they got AstraZeneca tomorrow, because there's 12 weeks between the AstraZeneca doses and 3 weeks between Pfizer.
Yep.
What would you do if you were an under 40 in that position?
Well, I would take the vaccine that's available today. Now, I say that fully. I'm double dose Pfizer vaccinated. I'm 49 years old. I got it when my age group became eligible. I didn't get it before then because I didn't think it was right. That I'm at no greater risk, really. The work I do means I'm probably seeing less people than more in a 1.5 metre contact point, I mean. Look, I would follow the advice. I think I've probably demonstrated, Rachel, that I'm good at following health advice. The health advice to me would be, as it is to every Victorian, get the vaccine you can get today. The appointment you booked in for today is much more important than joining a queue that might see you get vaccinated in weeks, maybe even longer. So we don't want to see those people cancelling if we can. But again, I understand this is a very personal thing. And as you point out, people are smart. People can work out that we're moving into a slightly different phase now. But every jab we get done today and this week is far preferable than appointments we'd make for next week or the week after. It's one of those dynamic things, and it is a race to 80. We've got to get there.
We have 6 million AstraZeneca doses in a stockpile being unused.
There's a lot of AstraZeneca around, yep.
Yeah. I think it was the Treasurer called it the biggest public policy failure of all time, our second wave last year. Where does it rank to have a locally manufactured vaccine sitting in a stockpile of 6 million when we're all in lockdown around the country, just lying there waiting to go into arms?
Oh, look, Paul, you're essentially asking me to sort of... Frydenberg's tennis player, isn't he? You're sort of asking me to hit the ball back to him. I'm not going to do that. I'm not going to get into an argument with Josh, because arguing with Josh doesn't work against the virus, just like arguing amongst ourselves doesn't get the better of this virus. I would simply say that the Federal Treasurer has taken a different tone and a different approach this year, I think, and I think Victorians are grateful for that. So I won't put that at risk by talking about hypotheticals. The AstraZeneca issue is, in many respects, a function of medical advice, a TARGI advice. In terms of Pfizer, you might just as easily have had a debate with me about, or asked me a fairly leading question about, why wasn't more ordered last year and stuff. Look, I like to stick to the stuff I can change. I can't change any of that. But it does explain why we are in the predicament we're in and why we have so few options. And I will never criticise someone for having a view and using whatever platform they want to use it. Although we don't want to see any more of those scenes we saw on Saturday. But I mean people getting on social media or writing opinion pieces or whatever. That's all fine. But okay, what's your alternative? What's the alternative? Vaccinate everybody. Righto. Well, I haven't got enough. Can't do it. We can do it over time, but we can't do it today. We can't do it tomorrow. It's going to take time. Why is that? Well, you can speculate. It's not really productive for me to. And in any event, I can't change how much supply we've got. I'm not doing the ordering. What we are doing, though, is more than 50% of the administration of these vaccines, which is well more than we ever kind of signed up for. But that's it. Get the job done. We're all pushing forward, and that's why I don't want to see people cancelling appointments today or any day. I want people to take up the more than 50,000 appointments that are available right now as I speak. Hopefully, some people are online already.
We are lagging quite significantly compared to New South Wales on vaccines. Do you think a side effect of the New South Wales Premier's kind of messaging to live with the virus and vaccines being their way out, is a side effect of that New South Wales people are much more incentivised to get a vaccine compared to people down here, when your language is geared towards 0 cases rather than vaccines being the way out. I don't mean to say that you're not also talking about vaccines, you are, but the focus here is 0 cases, not vaccines.
I won't use any deficiencies in the way you phrased it to avoid answering it. The answer is no, right?
Why not?
Well, because you can talk all you want, or anyone can talk all they want about living with this. There's no living with this until we get to 80%. And even then it will be challenging. And nurses and others will tell you just how challenging it's going to be, because it'll mean there'll be a whole lot of people in hospital, those that are not vaccinated. That's why getting those numbers up is really, really important. I think that there are we always knew that it would turn quite soon, perhaps it's got there a bit sooner than I thought it would, into a why is New South Wales doing X and Victoria's doing Y? Well, they've got a big outbreak at the moment, like a big outbreak. That does drive behaviour. It does have a sense of urgency. That's I think well proven. Would we like to swap situations with them? I don't think so. But the second point is they have been given additional supply, and we do know that supply really is the only limiting factor at the moment. I don't begrudge them that. I've always said, always, and not just when it served our interest, I have always said that the greatest support should go to those who have the greatest need, and that's what's happening at the moment. And if this virus hadn't come from Sydney to Melbourne, then our contact tracers wouldn't be chasing these cases. They'd be helping Sydney chase theirs. That's the fact of it.
Given the situation here and the rising case numbers, are we considering maybe shortening the period between AstraZeneca shots like New South Wales has done?
We've already made some changes the other way, so it's about trying to get more first doses into arms rather than less. So if you've got, and this is more a Pfizer issue I think, but there have been some changes and there's been advice around this. We've acted consistent with that, what's happening in Sydney is very much, I think the advice has changed because of the imminent threat and the number of cases they've got. If we got to that point and we could avail ourselves of that advice, we would. We've made some changes already. I'm happy to come back to you on what the most contemporary advice is.
Commissioner Shane Patton said on radio this morning that police are investigating a large funeral held in Shepparton. More than 100 people potentially attended by people from New South Wales. Can you shed any light on that situation?
No, I can't, other than, and I fully appreciate there'd be some interest in this matter. When the Chief Commissioner made that point, that's the first I'd heard of that. So there's lots of things to cover. I'm not briefed on that. I don't know that any such event occurred. I don't know what the circumstances of it were, if it did. But we can all be confident that the Chief Commissioner and his officers will look at those matters and any other matters that they think are appropriate. I just ask people, let's not jump to any conclusions though in terms of what's happened in Shepparton. People of Shepparton are doing it very tough at the moment, but they're doing an amazing job and we're deeply grateful to them. They're not just working hard to protect their community, they're working hard to protect all of us. And coming out and standing in queues for long, long periods of time to get tested, getting vaccinated in strong numbers, staying at home away from everybody else in hard ISO, that's really difficult but critically important work, and we thank them for it.
Just of the hospitals that you said haven't carried through the pre-operative COVID tests,
yes.
When did that stop and why?
I'm happy to get, I don't have a full list for you, but I'm happy to get any further information that you need. But again, sometimes different positions will be taken based on risk. Different risk profiles mean that different things are warranted, different things are important. Obviously we're not in the situation we were in a couple of months ago. We're in a very different set of circumstances.
Just on the 10,000 appointments that have been cancelled or no-shows, are they all saying it's because of the Pfizer announcement?
Well, no. I don't know that we necessarily get high-quality reasons out of people if they don't show up or they're not there. They just don't turn up. Some do ring and cancel.
The ones that cancel,
yeah, I'm not sure. I don't think we have a long conversation with them. It's often probably electronic. I think they just cancel.
How do we get that figured down?
Well,
I can't control. You must be frustrated by that, surely.
Well, I'm frustrated by many things. We all are. But the key point here is that I'd prefer people, if you've got an appointment, please honour that appointment. Please come forward and get vaccinated. The vaccines are safe. There's an informed consent process to go through, and as the Chief Health Officer keeps telling us, because it's right, the vaccine you get today is the best vaccine, not the appointment that might be weeks and weeks away. Please honour the appointment you've made, because that's real. There's a nurse with the vial, it's drawn, it's ready to go, and you will help yourself, your family, every family, and you'll help all of us in this race to 80.
Are we getting any wastage out of because of
Oh
the
no,
no-shows?
we notwithstanding my analogy just then, we manage our stocks very carefully.
Premier, just on that, in terms of supply, we've continued to repeat the message that there are plenty of appointments available.
There
But
are.
people that are eligible aren't showing up for these appointments right now.
Yep.
And we know that we're going to open to people under the age of 40 for Pfizer.
Yes.
Why not just in our state-run hubs, which you can control, open
Yes.
it now to make sure that if it is a race, we just get these jabs into arms ASAP?
Yeah, it's a good question, and I'll have more to say about who's eligible and where they can go and get it throughout the course of the week. So I know why you asked the question now. I'm not announcing any changes to who's eligible and where they can get the vaccine, but I am announcing today that there's 52,566 appointments, or at least there was an hour ago when we started talking about this. I dare say some of those appointments have already been taken up by viewers and listeners. So there are appointments there. Please go online and book them. It's about 60-40, 60% Pfizer, 40% AstraZeneca. That's if the trend holds on what it was when I last spoke to you about this, which I think was on Saturday, when there was about 85,000 appointments ready if memory serves.
You kept talking about
And we did see just in the not just the power of these press conferences, I might say, but we just saw, for instance, at one particular clinic where I think they had about 6,500 spots. We started mentioning them quite clearly on Saturday, and it went down to about 1,500 spots. So that's the reason I talk about it, because it works. I think it's a prompt for people to go and use up one of those appointments and help us all get to the 80%. Sorry, Rachel.
Talking about the issue of supply with vaccines, but as Paul just said, we've got a 6 million dose stockpile of a vaccine that is perfectly safe for the vast
Yes.
majority of people.
Yes.
Is that talk of supply being a problem part of the problem?
No, and what I would say to you is, I won't. The conversation wasn't held with me, so I won't divulge all of its contents. But I understand that the Secretary of my health department and the Secretary of the Commonwealth Health Department had a chat last week, and one of the things they talked about was that the Commonwealth Government was quite surprised at how much AstraZeneca we had got out. Like no one, I would say, no one's doing more than we are to try and get as many AstraZeneca appointments as we possibly can, noting that we don't have 10,000 cases and all that urgency that Sydney's perhaps benefiting from a little bit. Seems odd to say that there's any benefits in having that many cases, but I think you know the point that I'm making. We are pushing both vaccines. There is a process to go through. That's why we've at 51 clinics or something like that, we've got experienced nurse vaccinators, doctors, and pharmacists who are there having a clinical consultation with everyone who's booked in, saying, here are the risks. If you would like to provide informed consent, here is an AstraZeneca for you. That's happening across the board, and we're pleased to see so many people choosing AstraZeneca now. If it wasn't safe, it wouldn't be available. It's been through a TGA process, but there are some risks involved in any vaccine you take. And that's why people are encouraged to speak to a health professional, which is exactly what we're facilitating in our state-run clinics.
Given the Shepparton outbreak, will we be reallocating supply to the regions?
No, I think we've got sufficient supply to do the appointments that we've booked. What we don't have is sufficient supply to do 5 or 6 or 700,000 a week. I wish we did. I wish we could, or put it another way, I wish we had everything we needed to vaccinate everybody, like yesterday. But that's not where we're at. We just have to use the options that are credible and viable now. I know it's incredibly difficult, but we all can play a part. And getting vaccinated is just as important as following the rules or getting tested when you've got symptoms.
And I know we spoke about aged care workers, but do we have a more holistic picture on frontline workers, what the rate is of
Their vaccination status?
Yes.
I'll have more to say very soon about us having absolute certainty about who's been vaccinated and who hasn't, and that'll mean that we have even greater clarity, and not just frontline workers, but workers across the board. There's lots of different roles within the Victorian Public Service, lots of different roles, and lots of different roles in the private sector as well.
Other states have mandated the jab for hospital workers, like Queensland and New South Wales. So why not do that for hospitals who are currently concerned they don't know?
I haven't had a look. I haven't had a look in like the last couple of days about what our percentage uptake is like compared to other states. If I don't have advice that that's necessary. If I did have advice, then we'd have to have a long conversation and we'd consult with lots of different people, and we might well go down that path if we got advice to do that. But I've not got advice that says, oh look, it's at 25%, it needs to be at 80 plus. we've got to do something here. That's not advice that I've received at all. We're working through all those cohorts step by step, and the response has been very, very strong. Supply continues to remain a limiting factor in a broader context, but as far as priority cohorts, we've made very, very good progress. Very, very good progress, and we thank them for that. But they're not all finished. There's more that has to be done.
What's the target there? Would you want 100% of that frontline workforce?
Well, I think that we would want everyone who can physically, medically take the vaccine to do that. And clearly there are some people in public aged care that have not done that, and they will not be rostered on. And that won't be easy, but you've got to follow advice, and my advice is to take those steps. I do stress though, we're at 80+%, and we'll go even higher than that, I think.
Should those AstraZeneca jabs that aren't being used, those 6 million jabs, should they be sent overseas to Indonesia, to the Pacific Islands now? Should we have them sitting in a warehouse not being used?
Well, as far as distributions of unused vaccines to what the Prime Minister refers to quite often as our Pacific Island family, you should speak to him, because I think there's a fair bit of that work going on. I'd like people who've got an AstraZeneca appointment or a Pfizer appointment to turn up and get the jab, and I'd also like people to come forward and fill these vacant booking spots we have at the moment, and that'd be a really good day's work, I reckon. And I'll have more to say about vaccines availability, the profile, how we're going to get it out soon.
There's a Vietnam veteran that lives in Merimbula. He's just had his prostate and his bladder removed. He now needs a hip replacement. He can't do that without the support of his family, who's in Rye.
Sure.
His permit or application's been rejected. Is there anything you could do?
Well, I count among. I'm honoured and privileged to know many Vietnam veterans and to have worked very closely with them to honour their service and sacrifice and to support them as veterans of that war. On the specifics of that case, I'm happy to check that it's been reviewed as it should be. You're already indicating that there's been a no, but I'm happy to have people in the public health team have a look at that if there's anything they've missed. I apologise to any Victorian who can't come to Victoria because of what's happening in Sydney. I apologise to anyone who's impacted by these restrictions. If I had other choices, I would of course make them. If there were other options, I would make them, just like other premiers and the Prime Minister, I'm sure, would choose a different way if there was different options.
Just back on.
That's part of the heartbreak of this global pandemic.
Just back on Newport, Jereon has mentioned breaches in terms of isolation in that area before when it comes to Newport.
Yep.
And today we've called out men and people who go to gyms. What's the story behind some of the infections that we're seeing that's resulted in that call out today?
I think that there are, again, you've asked the question, so it's not a matter of raging against people from the podium. You've asked the question. There are some examples of people who perhaps have had symptoms for quite some time and have not necessarily acted on those symptoms. We can't change that other than to call people and call it out and say, please, once the sniffle starts, the scratchy throat, the headache, the fever, go and get tested that day. Please don't wait 3 or 4 days, because you'll just infect everyone you love in that intervening period. There's then, I think, also been, from time to time, people will be asked to isolate. Not 100% of people do that. It's just and there is perhaps a pattern. As Jereon's spoken to a particular age group. I'm not making that point. I'm simply saying, I'm making a broader point in that everyone's got to follow these rules. If you're asked to isolate, whether you're young, old, city, country, doesn't matter. If you've got it or you've been in contact with someone who has, you have to stay in, and you've got to stay in for the full 14 days.
But why the gyms? Are there gyms?
No, I think Jereon's using. Again, I think Jereon is using some examples of people who may have had symptoms, for instance, who have gone doing other things. They've gone on with normal business, as it were, and we just can't have that. We've got to, all of us, take these rules seriously. And if requests are made to you to isolate, or the requests that I keep making every single day to get tested as soon as you have symptoms, I don't do it for fun. I do it because it makes a massive difference in the number of cases. In a broader context, Mark, no set of rules will have 100% of compliance 100% of the time, right? But that's not an excuse. And that's why Victoria Police are out there and they are issuing fines. And it's why people are calling out family members and calling out neighbours and friends, and because whether we like it or not, we all feel the impact whenever people don't do the right thing. So that we can't change that, other than just to make better choices. And if you think about the number of choices you make in the course of a day times 6 million, it's it's something that's really, it's challenging. We have to be vigilant.
I get that, but maybe Jereon, are there gyms still operating, or any backyard gyms that we know about? Why was that mentioned?
Thanks, Trevor. Look, it was mentioned, Mark, as an example of there are this virus, this outbreak, the cases we're dealing with right now, the cases we've been dealing with in recent days, are affecting every demographic of our society and our community. So we've got men in their 20s who need to be getting out and getting tested. Now, I don't care whether you go to the gym or whether you're kite surfing. That's all great. You might think you're indestructible, but we need you to get tested if you've got symptoms. We need people to keep an eye on their kids. We've got 112 kids under the age of 10 who've got coronavirus right now. It's really important that as a parent that we not only observe our own health but those of our kids and people around us. So absolutely, yeah, we do have, this is not an old person's thing. This is not about an older demographic that we were dealing with last year. This is affecting every one of us in every age group. And I mentioned Newport. Absolutely, we've seen cases emerging day after day in the Newport area. We had the Elite Spotswood gym that was active as an exposure site a couple of weeks ago now. We're still seeing cases emerging in that wider network of people who've got some connections to the gym. It's not the gym's fault. It's not those individuals' fault, but it's a call out to say, please, this is not something which is about somebody else. When you've got cases in Sorrento and when you've got cases in Point Cook and in Thornbury, you're dealing with a widespread outbreak. And all of us just need to wise up to that. Rachel.
How symptomatic are the cases you're seeing is part of the problem? Are there kids, for example, who aren't sort of communicating to anyone that they're actually all that sick, and that's part of the problem? Or?
So we've got everything, Rachel. So we've got absolutely cases of people who are asymptomatic and who are genuinely quite surprised when they test positive. We've also got examples of children, collapsing at school and vomiting at school. That's how ill they are. And when we then go to the households, we realise that there are not just one person's positive, but actually there are a number of people in the household who are positive. There are a range of symptoms being displayed. So not everybody's symptomatic. And look, this is all about, if you think you've got symptoms or someone next to you's got symptoms, somebody you care for has got symptoms, just encourage them to get tested. There's no downside for getting tested. The Premier's gone through the support we provide, $450 to get tested, $1,500 should you need to isolate as a positive case, and we will provide whatever support we need to get you in the right space.
And you mentioned Newport. I guess you were able to elaborate a little on that, and that was essentially ground zero for this nearly 3 weeks ago. How frustrating is it that you're still seeing cases coming out of that
look, it's a reality. It's a reality that I think the first phase of this outbreak, the initial couple in Newport, the connections to Caroline Springs, the schools that we've talked about, was exceptionally well controlled by those communities, and those people did a fantastic job in coming forward. What we've seen in some of the subsequent exposure sites, the Tire Plus locations in a number of places in Altona North and Hoppers Crossing and in Newport, the gym that I've mentioned, a couple of other locations where we continue to see people coming forward who are presenting with symptoms late after having seen symptoms, and who then say, yes, I did have an association with that 10 days ago, 2 weeks ago. So that, of course, that's frustrating. But the hope in all this is that we're seeing again more positive cases today. The hope to that is that collectively it's a wake-up call for all of us to say this gives us leads to work on. It allows us to go and do the contact tracing for all those 71 cases, to wrap all those cases up, to isolate all their primary close contacts, because that's the work we do. We just need to be confident that everyone who's got symptoms is coming forward. And if that describes you today, we need you to get tested today.
What's the kind of narrative of the outbreak, Jereon? When did we lose control? When did it break out of the rings that we know about? Was it through essential workers? Was it through home visits? What's the kind of story of how we lost control of this?
Yeah, it's a good question, Paul. And I think last week, probably around Wednesday, Thursday, we described this outbreak as having 3/4 of the cases, 80% of the cases, all associated with that original Newport, Caroline Springs, Glenroy, and major schools cluster. Very well controlled, and we had that little loose front around St Kilda and a few other places around Brunswick. It was pretty well controlled at that point and very clearly connected. What we've seen since then is the Shepparton outbreak is not as yet genomically or otherwise connected into what we're seeing that's happening in Melbourne. That is a major concern. Is that a new incursion in from New South Wales? Is it some kind of other connection point between the existing outbreak we've known about? We don't have that data at this point in time. And in the last 3 days, we've seen a fragmenting of lots of individual cases. So of the 494 cases, 452 are all linked, and we understand the connections by and large between them. It's those 42 cases where we're saying we can't yet see the linkages. Now we'll do that detective work now. We'll connect a whole heap of those back into our outbreaks. What I don't have clarity of at this point in time is whether we've got multiple incursions that are generating different fronts of this outbreak, or whether it's all connected. But the urgency for all of us, for all those people who are listening or paying attention for the reports that you guys write, the urgency is for people to realise that this is now really close to everybody. So it's no longer a Newport and Glenroy problem, even though there's some challenges there. It's not a Shepparton problem. We've got a case in Mansfield. We've got a man in Mansfield in his late 60s who's a positive case. Mansfield's a million miles away from Melbourne. It's not, it's a feral whack to Shepparton. So that's what we're now dealing with. So we cannot be complacent.
Can you tell us on that Mansfield case, what's that person's relationship to Shepparton, and was that person working at Bonnie Doon and possibly infectious as early as the 9th?
Very good, Rachel. So it is an individual connected and working in Bonnie Doon in his 60s. He did have a trip into Shepparton, although the dates don't quite tie up in terms of when we know he was in Shepparton and the onset of his symptoms. So there's more work to do on that front. But this individual, presented with significant conditions at the weekend to Mansfield, then to Wangaratta ED, and is now in Northern Hospital and receiving good care. But again, so we don't, we have some interesting links. Don't yet have a fully nailed down story.
Do you know when he visited Shepparton?
I do, but I don't have it in my head.
Brian, are those Newport concerns, are they centred around the footy club and that demographic that footy playing? Do you think there might be some missing trains of transmission around the footy club?
So look, I think it's two things. So we're certainly seeing a number of people who've got an indirect or a second, third, fourth tier connection back into the community around the footy club. And again, the footy club president and the team there have been fantastic in helping us get the message out and to work with their community. But we're seeing people, to Paul's point, who are 3, 4, 5 rings out from the footy club, but who are turning up positive at a relatively late stage in the day. And then, of course, when you get to that point, you're seeing other exposure sites coming up. So, look, my simple message is, if you're in Altona North, if you're in Newport, if you're in Hoppers Crossing, we're seeing active community transmission in that area. We've got a heap of exposure sites in that area. Check out those exposure sites and get tested if you've got connections to those places or if you've got symptoms.
You mentioned you're still worried about St Kilda.
Yeah.
What's
Oh, look, nothing specific. It's a good day in St Kilda in that the sun's been good yesterday, but more importantly, we're not seeing any positive cases in the last 24 hours. That's encouraging, but we're not out of the woods yet. So we have at least two distinct clusters going on. One around that St Kilda East, Caulfield North area. The other around more the sort of Fitzroy Street area. We're still very interested in anybody in that area who's got connections to those exposure sites or symptomatic.
Royal Melbourne Hospital staff who are primary close contacts are
Yeah.
being told they may still be required to come to work throughout their quarantine period because they are short-staffed. Is that concerning to you?
No, so there's been a huge amount of work by RMH and by their leadership teams and by the whole health services. Many calls with our health service colleagues over the weekend to put in place our response to this. There are a range of very robust furloughing arrangements in place in all of our health services, and we manage that on a risk basis. So absolutely, where we've got certainly staff members who've been directly exposed and who've turned positive, and they'll go through their normal arrangements. We've got essentially a micro tiering of tier ones within our health services that relates to what they've been doing, what their exposure is, and additional testing regimes in place for them.
Jeremy, we had a warning from the Premier last weekend that if the weather was really great this past weekend gone, that we might be in a lot of trouble.
Yep.
We'd also been discussing this idea of fleeting transmission. How many of the traceable recent cases have occurred through fleeting transmission? People that don't know each other, that were indoors or outdoors in the same place and caught it from one another?
So look, I think, and it's a good question. So we will see, the results of the last few days and the demonstration on Saturday. We will see that in the coming week. So we're not going to see that today or tomorrow. We'll see that towards the end of this week and next week. Earlier, if people who are symptomatic get tested early, and that's what we really need them to do. Look, in those 42 cases I've talked about that we're doing all that detective work on, I'm convinced there'll be significant fleeting transmission somewhere in that cohort, because these are not cases that are coming up as being primary close contacts. They're not coming up as secondary close contacts. They've got no obvious connection to an exposure site. So this is where the deep work goes on. So I'm not surprised as we see almost 500 cases that we have a just under 10% cohort of cases that are more difficult to pin down, and it will go into that fleeting transmission space.
Just following on from fleeting transmission.
Sorry,
As early as
Alicia.
August 10, we were seeing high levels of COVID-19 in the wastewater in
Yep.
Shepparton. It
Yep.
took more than a week to actually discover a case there.
Yep.
Is there a way that we could have discovered that case earlier?
Oh, look, I mean, the short answer is people getting tested earlier. I mean, Shep is a highlight for us. It's a shining example of the earlier people get tested, the quicker we can wrap that support around it. So we've now got 8 households, a lot of young children, 3 major schools that are now all closed down, and a massive response in place. That could have been put in place 7 days ago, 8 days ago. That would have reduced the number of cases now that we're having to track down in Shepparton, and would have been a better support for those families concerned. So, and again, my message to parents in particular is, if you're concerned about that your child may not be 100% right, if you're concerned about yourself, the quicker we catch hold of that, the better we can protect the rest of your family. Because we've seen how COVID attacks families. When you've got, I think, 4 households in that Shep cluster, every single person in that household is a positive case. That's a phenomenal attack rate. We saw the same thing in the West with some of the schools.
I'm just
following
doing
on-
like asymptomatic testing in areas where you're continuing to get the repeated
Look,
infections of
well, we
COVID-19?
I mean, right from this podium, I think the Premier did it, Minister Foley did it. We did a lot of call-outs around Shepparton when we first saw those wastewater detects going back, as you say, about a week or so. And we saw 1,500 tests being underdone within the Shepparton community over a 1-week period. So we saw a really good response, a big step up in people getting tested. We just didn't see the people that are positive. And that is, of course, a source for regret. And it just highlights a message that I know we've been boring on about for so long now. Just get tested. You got symptoms, get tested.
Just following on from...
Or public health judgments, but you understand the outbreak and the dynamics of the outbreak.
Yeah.
How far behind are contact tracers, and how many weeks do you think it might take to get a proper ring around it again?
We're not behind. We're not behind. What we've got is a significant number of mystery cases that are seeding out into other communities. So we're on top of every single case. We're on top of every single set of primary close contacts. Our team are working, literally around the clock through our labs, through our contact tracers, through our phone operators, through our over 800 visits we do on the ground. So we will continue to run after all these cases until isolate all those primary close contacts. Those numbers will continue to the PCC numbers will continue to rise. But the onus is now also on the wider community, because this Delta moves frighteningly quickly. We've seen it here in Melbourne, we've seen it in New South Wales, we've seen it around the world. So this is a drag race. We will go as hard as we possibly can, but we need everybody to be aware that if you're continuing to socialise, if you're continuing to see each other at home, if you continue to pop in and see your mum, if you're in Sorrento at the moment, there's a positive case in Sorrento right now, and you don't know whether that person's at a cafe next to you or whether they're the person you're going to pop in to see if they're okay. That's the reality of what we're dealing with.
Is there any chance of getting a proper ring around it by September 2?
There's every chance that, look, if we continue to work together, and we've pulled down 6-7 outbreaks now in the last 7 or 8 months. So collectively, as a Victorian community, we can absolutely do that. We can cap hold of this, and we can cap out the rising cases and get it down. Because if we don't, we look on the other side of the Murray, and that's what's awaiting us, and none of us want that.
A quick question, Premier. You've just said that 10,000 people are cancelling vaccinations or not showing up every day. If the golden ticket to freedom, getting out of lockdown, is reaching 70 or 80% vaccination rate, how much of a priority is it for your government to understand why people are not showing up or cancelling? What more can we do to understand why?
We'll look at that's a significant increase on what it was a week ago. But there were announcements that were made last week, and within hours of those announcements, we saw people cancelling their bookings. Like, I can't be any clearer than that. That's the fact of it. Again, I can't change that, and I'm not even bothering to be critical of that because I can't change it. But that's the fact of it. People will make judgments. I'm asking them to make a slightly different judgment and to acknowledge there's one really important point here. The appointment today is better than a booking in a fortnight or a month. Please turn up to the appointment you've made, or go online and make an appointment. There are 50,000+ of them available, Pfizer and AstraZeneca, this week at our state hubs. Plus there's activity in pharmacies, there's activity in GP surgeries right across the board. Let's focus on the things we can change, and what we can change is the number of people who are not showing up. Hopefully that can be driven down. And hopefully all of those vacant appointments, those unfilled appointments, available appointments, can be snapped up. That was certainly the experience when last we focused on this at some length on Saturday. We had one clinic went from 6,500 spots down to about 1,500, I think. So people are watching and listening, and they do want to get vaccinated.
If the Prime Minister had made the announcements that you've just referenced differently, if his messaging has been different, are you saying that you don't think we would be seeing those cancellations now?
I'm saying I don't have any power over what those announcements are, and I don't just as I've said to you many times, I don't have a crystal ball, so I was asked the question. I don't want anyone to think that there's, somehow a big phenomenon going on that we don't have a pretty good operating theory on, and we do. So I've answered the question frankly. Can I change what happened last Thursday? No. Let's just all focus on getting as many jabs in as many arms as possible, and that means people have to turn up. If you've got an appointment, please use that appointment today, because an actual shot in your arm today is far preferable than a booking in a few weeks' time. There'll be bookings in a few weeks' time. That's not unimportant, but if you've got that choice to make, being in a big queue or being first dose vaccinated, that's an easy choice to make.
Is that 10,000 cancellations on the, say, 29,000 shots? So we're talking maybe 1 in 4?
Oh, they won't all necessarily be people who don't show up on the day they cancel. Some people will give us some advance notice, but that's the number that I have.
Rob, are you concerned on Friday about this coming weekend, and you didn't want to see the behaviour of the previous weekend repeated? What did you make
I think
of,
by and large, well, I might leave Victoria Police because their data is a little bit behind on the 24-hour cycle, but notwithstanding the disgusting scenes we saw at, I won't even call it a protest, it was just a mob really, protesting all manner of different things, and a whole lot of them intent to have a fight, almost irregardless of what had brought them together. The few there that wanted to punch on, plain and simple. Notwithstanding that disgusting behaviour and illegal behaviour that will be punished, that's what the Chief Commissioner's made clear. I think by and large we didn't see kind of pop-up pub crawls, we didn't see some of the stuff we had seen the previous weekend, and I thank Victorians for that. I thank every single Victorian who spent the weekend following the rules, despite the brilliant weather and despite the fact that we would all desperately love to be doing different things. Those options are not available to us at the moment. They will be available, and they'll be available sooner if A, we drive down cases by all following the rules and particularly getting tested if you've got symptoms, and B, if you've got an appointment for a vaccine, go and get the vaccine. Don't cancel the appointment. Go and get the vaccine today or whenever your appointment is. And in terms of others who are eligible and have kind of been maybe on the fence about whether they'll book or not, there are 50,000+ appointments available just this week at a state hub near you, and many of them, well, all of them are open. There's more than 50 of them. They're open and they're busy, but we'll get you through quickly.
One really quick one for Jereon, if that's okay.
No more for me?
Just quickly on Victoria Police, considering shutting
Sure.
down the city and to try
Yes.
to avoid another protest. Any comment on this?
I'd leave Victoria Police to comment on those matters, but what we saw on the weekend is not acceptable, and as the Chief Commissioner has indicated, where they have grounds to go further, they absolutely will, and I send my best wishes to each and every one of those officers who was injured, to their families. I thank them for their service, and I remind all Victorians that that sort of behaviour is just not on. It's disgusting, and it will not be tolerated. Very good. Now, one more thing for Jereon.
Jereon, I think you mentioned there are now 10 people who are part of the Royal Melbourne Hospital
Yep.
cluster. Do you know how many of those people are currently hospitalised?
I can get back to you on that. I don't have any information at the moment.
And I just have one for you as well, Jereon. With evidence of outdoor transmission with this highly infectious Delta variant of the virus, do we know much about, do we have any data on how many cases we've seen transmitted outdoors and what that means for outdoor playgrounds for children?
Yeah, look, I think, and it goes to the earlier question in a way. So, look, I've got certainly within those 42 cases we're still working through, the mystery cases over the last couple of days. We'll continue to see what linkages there are. There will be, I'm sure, examples there of outdoor transmission and fleeting transmission, but we'll give advice on that as we go along. I think last week I gave 2 or 3 examples, 2 examples on transmission between children, outdoors, in that kind of setting.
What's the condition of you mentioned infant
Yep.
who's in hospital? What's that
So it's a very young child, I believe, with a parent in hospital, not stable, but obviously always concerning to see a very young person in hospital.
So it's more of a precaution that the child's in hospital?
Yeah, I mean, they're sick with COVID. I mean, yeah.
Yeah.
Okay.
Thanks very much,
Thank you all. Thank you.
Thank you.